Again, thanking the American Acupuncture Council for this opportunity to share with you, my colleagues. My name is Lauren Brown. I'm a doctor of traditional Chinese medicine. I'm a clinical hypnotherapist. I'm also a CPA. I'm a certified professional accountant. And I wanted to talk about the acupuncture wow factor. And I'm going to set my intention that this will be simple and yet powerful and effective. That comes from the Einstein quote that make things as simple as possible, but not simpler, meaning let's make it simple so it's easier to implement, but we don't make it so simple that it loses its effectiveness. And also my intention is to do a small soundbite here so you can just take one concept or one idea and run with this in your practice. I have found that sometimes the things that help practitioners be the most successful are the most obvious, but yet they're not obvious until somebody brings it to your attention, to your awareness that you're like, oh, yes, I want to intentionally do this. And so the wow factor that I'm talking about is for your patients to have a shift on your table and experience a shift so that they are able to relax and therefore have the trust and confidence to follow your treatment plan. Now, I'm going to unpack this for us and I'm going to talk about this from, I guess, a materialistic and quantum level here. So, when we have resistance, then we block flow and receptivity, things that happen for us in life. And you've probably experienced this where sometimes you just have flow and receptivity. Synchronicities are happening and things just seem easier. They just happen and flow for you as if there's these invisible hands coming down from the heavens and opening up doors you did not know existed. You're probably also aware where you're putting effort and more effort, and the more effort you do, it just seems the harder things get and things just aren't easy and there is no flow. And on a quantum or spiritual level, when we have resistance, we're blocking this receptivity and flow. We have a beautiful term for this in Chinese medicine. It's called qi stagnation. In conscious work, I often hear it called as resistance or friction. And this ties into our patient's ability to heal because the body has this beautiful innate ability to heal. And I see my role as a practitioner as a facilitator. I'm not healing the person in front of me. We are learning more and more through really cool research, again, quantum physics level research, that it seems to be that it's the patient's need that determines the healing. And we as practitioners have to be that clean vessel, but we are the facilitator. And even our nervous systems, our parasympathetic nervous systems, our subconsciouses, they're syncing up. They're doing this through fMR studies where they can see that the nervous systems are syncing up beyond our conscious awareness. And there's a healing, an exchange of information that happens. And we use our needles sometimes to do that exchange for information. So the wow factor for us, now I want to unpack this and go back into this patient's innate ability to heal, that if they have resistance, they're not sure if you can help them. They're not sure if it's worth their money. There's that trust issue. Do I really believe this? Does acupuncture work? What the skeptics are saying, what conventional medicine's saying, all this can get into their psyche and disrupt their ability to receive and have flow. So disrupt that innate ability to heal because that placebo impact, which has such a bad rap, placebo is not inert. We know this in 30% of Western trials, in Western random controlled trials. Sometimes it's common that 30% and up to 90%, but it's common 30% they attribute to placebo. From a Chinese medicine perspective, or at least from my perspective, what we are doing is engaging the individual's capacity to heal. They have this innate ability to heal. It's amazing how we try to dismiss this, but I guess from our materialistic perspective, from conventional medicine, we have that ego that we're doing the healing, but really it's the individual. They take the medicine, and through that medicine, they incorporate it and heal, or through our needle, or through our communication, the healing process starts. The acupuncture wow factor to allow the resistance to be lowered so the patient is in that state of receptivity and flow to really accelerate and accentuate the innate ability to heal, that healing process comes from them feeling an experience a shift on the table. And so I'm going to give you at least two examples here. And I'm thinking of recent lectures on healthyseminars.com where I hosted in 1 week both Pony Chong and David Euler. It's actually pronounced Euler, but spelled Euler. David Euler, you probably know him if you read his name, but David Euler and Pony Chong. And their style of acupuncture gives the patient this incredible shift on the table that even if they don't have resolution on the table in that one treatment, which is, let's be honest, we don't get that resolution for chronic conditions in one treatment, but because they experience that shift, they now have that ability to have trust and confidence to follow your treatment plan. And it's been my experience in my own clinical practice using their style of treatment and also call my colleagues that patients then leave the treatment room and book their 12 to 15 treatments in that 2 to 3 month period because of the experience they had on the table. So when I talk about shift, let's bring up David Euler first as a concept. And then I actually have a video demonstration that I have with Pony Chong that I'll share with you. With David Euler, he does palpation-based acupuncture. He studied with Kiko Matsumoto and her teacher. And it's a really cool style of somatic acupuncture where you're palpating tender spots on the body. And based on those tender spots, those are called reflex zones, you needle other areas to release the tender spot. And by doing so, that experience for the patient is an aha moment. So I'm going to share a story with you, for example, and I'm going to do the David Euler idea of palpation, how this works in the treatment room. But here's one of my own clinical stories, and I'm going to share one about Shen disturbance that David shared recently in his lecture. This woman came to me after 2 months post C-section delivery of her baby, and she had poor quality of life because of the incredible lower abdominal pain that she had since the birth of her child. And she went back to the surgeon, the gynecologist. They ruled out any infection. They ruled out anything left inside. And they just said, there's nothing going on there. There's nothing they can do. Obviously, she didn't want to take high dose or pain meds because she's breastfeeding. She had saw massage. They had referred her for some physio for post-surgical to help. Nothing had helped over those 2 months. She came to my practice. She knew of me because I actually was the practitioner that helped her with her infertility. And I guess we have branded ourselves so well at fertility that because she wasn't trying to get pregnant, she didn't think to come back to my clinic until later saying, do you think you can help me with this? It didn't even dawn on her that maybe this is something we can help. And so she came into my practice with her lower abdominal pain. And right away, I thought about the oketsu. And for those that are not familiar with that term, it's basically a reflex zone for blood stasis. And when you have this, it can wreak havoc in the body. Because remember, it's a system. If we have a serious stagnation, it interferes with the flow and receptivity, right? And I pressed down on her oketsu, and she's, ow, ow, like incredible pain. And so after pressing in on the oketsu, I go to the distal points that are used to relieve that. It's just two acupuncture points. And I hold my little device, just the tube with the needle actually, and I try different angles on liver 4 and asking her as I palpate, does this reduce this pressure pain? And she goes, oh, you're not pressing as hard. So she thought I was trying to fake her out because she went from like a 10 out of 10 to a 2 out of 10. And I said, I'm pressing the same. How about you press? So you take my hand and you push down. She took my hand and pushed down while I used the handle of the tube, no pain. So I go ahead and I needle those points. I also noticed that her immune reflex was really sensitive. So I did the immune points. And a week later, I did follow up with her, and she was immediately at that treatment 90% relief. So she had 90% relief immediately after that treatment. And 1 week following, she still had 90% relief from that treatment. That's where somebody like that now refers anybody and everybody to the practice, and any plan that I would have for her, she is more relaxed, as in has the confidence and trust in me. One is she had relief in her symptoms, but I'll share with you that even if the symptoms aren't relieved, when they experience the fact that I can palpate an area, a reflex zone, and then needle somewhere else, and then that zone is gone, they see that it's doing something, and it inspires them to now follow your plan. In his course also, he talked about the reflex zone in the sternum for anxiety and Shen disturbance. And there's points that we do on the back for this, and there's points that we do distally for fire points on the pericardium and heart channel. We test the fire points to see if they're tender as well, and then we use metal and water points to relieve that. And again, when patients come in and they're really anxious, so the difficult trusting because their sympathetic is on high alert, that means can't trust, right? They're really cautious, paranoid almost, really feeling worried and anxious. Palpating the sternum, and it's tender for them. And then going and touching reflex zones on the back. And then if that relieves it, great. If not, then I go to the fire points on the palm, and then I check the acupuncture points. And if that relieves it, you can just see them melt on the table. So that's my example as a shift on the table. And so learning styles by like David Euler is a way to really grow your practice. Now, I was trained as what I call a barefoot doctor or Zong Fu acupuncturist, which I think many of you have been trained as well. Meaning, like if you have blood deficiency, it's stomach 36, it's red 12, it's spleen 6, bladder 17. Really, these are my herbalists from China teaching me acupuncture. And because I host healthy seminars, I've had the privilege and the opportunity to witness different styles of acupuncture and realizing that there is a really deep history and style of acupuncture more than how we were trained in TCM schools, where you can get really good results. And also, there's that impact on the table. And so, David Euler is one of those examples of studying with him and being able to just palpate some points, relieve them right there, that first treatment in 20 to 30 minutes with that treatment. And then they continue on for their condition because they've seen such an experience of that. Plus, they also are getting resolution for what they've come in for. Let's talk about Pony Chong, another style of acupuncture. And where they're in common is he shows a shift on the table. And in the video that we're going to bring up is from a lecture he did recently in our community library. And what he's demonstrating is he's doing an acupuncture point, spleen 12, and he talks about in the canon of the classics, just where it travels on the sinew channel and how it impacts what muscles, what ligaments, what tendons, basically in modern day, so he can treat certain conditions in the lower extremities. And he's going to needle the point, and then he tests the point with a pointer plus. And he does this because of two reasons. One is when you test it, it lets you know you're in the right place. Because I'll share that sometimes we always have the right intention. This is where I think spleen 12 is on this individual based on landmarks. But Pony has shown through his style of acupuncture that it's reproducible, that you can be really precise based on reading the description of what this acupuncture point does on a muscle skeletal level and seeing that muscle shift or move or fasciculate when you touch it with a pointer plus. From the patient's perspective, it is a wow factor because they know where their pain is in whatever their leg. And when you put a needle in and and they feel that sensation going down that whole muscle, they now have the confidence that you are in the right spot. The second reason it's so important that I went on a quick tangent there about the patient's experience is sometimes we have the right intention of where we think the point is, but points actually drift. They're not the same based on the book location on every individual. There's a little bit of drifting. And Pony style of acupuncture teaching shows you that you can actually get exact and know that you're in the right spot by testing the needle. And I have to share, when I use this in my practice, sometimes I have to reinsert the needle 2 or 5 times to get it. But now you get better results because originally my intention was this is the right spot for this point, but I can test and show whether I'm really in that spot or not. This is also going to be important for research to make research reproducible. Now we know we've given them the right acupuncture point for where it is in their body. And so this wow factor is crucial in having patients relax. So lowering the resistance, having confidence and trust to follow your treatment plan because they experience a shift that first treatment, not let's treat you for the next 10 or 12 treatments and see if there's a shift and then we'll reassess. They believe after that first treatment. So let's bring up the video. I will share with you the first 5 seconds, the volume's low, or 10 seconds, and then it kicks in. And this is just a discussion that I was having with Pony in one of his community lectures while he was demonstrating this idea of testing a point and how the patient experiences this. So please bring up that video now. And Pony, this is what I
Yeah.
mentioned in our introduction. If you could just go back to that video for a moment, that when a
Okay.
patient experiences a shift on the table, and in this case, when Pony needles the point, and then he stimulates it with his pointer plus, the structure of the leg, the muscles and
Mhm.
ligaments Watch the and leg tendons move in the bottom move, left, guys. Watch the leg in the bottom
Mhm.
left.
Mhm.
Confirming
Mhm.
he's in the right location, because it wouldn't move. If he was in the correct. Two things happen. One is he has now accurate needle location, because we have good intention and we say we're putting it in spleen 12. We put the intention. But Pony is showing that there's an actual real spleen 12 for each individual, and it can drift a bit from how it's described in the book and based on the person. And he's confirming that he has reached spleen 12 based on what he's seen in the leg. So, A, for effectiveness, preciseness. Two is the patient is seeing what's happening
She's
to
not
their
moving
leg,
her leg.
and it just
Her
gives
leg.
them the confidence and trust
It's
to
the
then
TENS machine on the needle
follow
that's
your
causing the
treatment
leg to
plan.
move.
And that's why I invite you to check out Pony's courses in the library, and then really do a deep dive. And he has those courses on demand, so you can learn how to do this in your practice. Thanks, Pony.
No problem. Yeah, thank you for Lauren. Thank you for mentioning the word intention. That's something that I emphasize a lot when I teach the course. Is that we're taught that okay, you have to have good intention, right? And your intent drives the chi. Okay, and so it drives your chi, but also through the needle you drive the patient's chi. But that's pretty much the end of the education I got in intention. It just but extreme attention is the same. But the way I see it now, based on my experience and all my research, is that there's a different intent for each specific point, and that you can predict and agree on that intention if you understand anatomy. So, for example, here, spleen 12, the anatomy is the femoral neurovascular bundle. So the intention that when I come to needle this point is that I want this to activate the quadricep muscle. And if I apply electricity to that, it will activate all the quadricep muscle and then you extend. Okay. So it could be a sensory nerve, in which case we know where that nerve travels, the Dutch sensation would be felt to that area. It's not a guesswork. You should know exactly what that intent for that specific point should be and know if you got it or not based on whether it moves what it should, goes by sensation where it is. So then your intent is actually very clear and precise. And it's not just assuming that intent is the same. It's not just dull, heavy, achy sensation everywhere, anywhere. Okay. But also coming back to sort of like the buy-in, the wow factor, patients are not going to remember the times that you don't succeed. But if you tell them, okay, I'm needling this, I'm checking this, they don't know what they're supposed to see, right? Only you know that. But you tell them that the reason I'm doing this, I'm checking to make sure I'm precise. But you stimulate it. You tell them you may feel a sensation going down the top of your quadricep. You might feel a little contraction in your muscles and quadricep. And if you say that and you try it, and if it's one of those times that you succeed, they feel that's instant wow because that's in a way prophecy. Prophesize what's going to happen, and then it actually happened. Average mortal human beings don't have the ability to prophesize, so that makes you different. That you can do something and make it happen exactly what you said it's going to happen. They're not going to remember if it doesn't happen, but they damn remember it when it does, and that is the wow factor that Lauren is talking about. Before you're even done treating them, it's the first treatment, they haven't saw the result yet, they're already asking, do you treat this for my brother, do you treat this for that? Okay, this is from my personal experience.
So I like his term, the prophecy. So you're prophesizing for the patient, and then they experience it, and that is a wow factor. And like he said, can you treat this? Can you treat this for my family members? Because you're able to predict what they're going to experience. And so, from a practitioner with integrity and intention, you've got the accurate point. So you want the results. So you know you have the accurate location. And then from the patient's perspective, they've experienced this prophecy on the table, which gives you that guru status, and why some practitioners are constantly looking to fill their practice. And like others, like my practice, I usually have a 2 to 3 month wait list because of that wow factor on the table. And then when you learn from like a David Euler or Red Euler, but pronounced Euler, or Pony Chung, they give you language too to help with the prophecy. So going back to David's talk where I mentioned for anxiety, he'll palpate a typical area on the sternum. And when I go and palpate these reflex zones and they're tender, and then I needle elsewhere, and then those reflex zones go away, that's the prophecy, because I'm telling them that if we can remove the blockages in the body that are preventing the innate ability to heal, if we can lower the resistance and bring back chi flow, your body will start to heal, regardless of the Western diagnosis. I just got to remove some of these disturbances in your biofield. And that is why I think, to my colleagues, that studying with Pony and David, or having that wow factor where a patient experiences your prophecy in the treatment room because they experience the shift, is important. And the last thing I want to share for a wow factor, or just what I have found in my 20 plus years, sometimes complicated cases come in. And I have to remind myself that it's not my job to fix the patient. And if all I do is listen, really listen, and let them know I hear them, then the healing process starts as well. Remember that there is something, and this is being studied, that we know that there's communication through our facial expression, our eyes, pheromones, and even biophotons, light and packets of energy that are transmitting between us. That we now know that there's information being exchanged. And what we're noticing is that when somebody feels really seen and heard, that lowers their resistance as well. They start to relax, the flow starts to come back, and the healing response is engaged. And so, really taking time to listen to your patients, showing compassion that you understand and get what they're going through with, is really important as part of the healing process. So, really making that time to hear them, they feel understood. That lowers the resistance. And again, on an unconscious level, not something that you're doing or they're aware of, something is happening between the two of you. Something has been triggered, and there is exchange of information. Add on to it when you do your treatment, and you can prophesize that when I palpate here or anywhere, there's points all over the body and they're tender, and I needle elsewhere and that tenderness goes away, then we have lowered the disturbance, the resistance in the body, which will support its healing. I will share that when I was at the Society of Acupuncture Research Conference, one of the presenters there shared her research where they have shown they have shown that when there's organ issues, that down distally in the fascia, that there's disturbances. So tender points or even nodules or gunkiness happens. So they're sharing that this is happening. And when I heard this research, it made me think of David Euler's palpation-based acupuncture style, because that's their style, is going along the channel and palpating these points. And if they're tender, then there's other points to needle to relieve that tenderness. And what I suspect is happening is we're lowering the disturbance in the body, the resistance, and therefore the channel flow becomes free, and then the organs become healthy and the organism, us, become healthier. And so I just wanted to share that with you. Lectures by both Pony and David are available on Healthy Seminars in the community library. They also have CEU approved courses on healthyseminars.com in that area as well. And a good way to just find out what I'm up to, if you like this quantum idea and biophysics, do check out just my website, lornebrown.com. Then you can see information about my practice management book. You can hear about my Conscious Fertility podcast, things that I'm doing at Healthy Seminars. I created that website because I like to do a lot of things, and I decided to create that website so you can find everything in one place. So lornebrown.com is to just go where everything is collected. And then healthyseminars.com is where the continued education, the community library, the mentorship, and the online learning is for Healthy Seminars. So I hope what I shared with you is simple for you, and you'll find it powerful and effective. It's been my experience, my colleagues, and for the patients, they have found it powerful and effective. And I wish you the best of luck in your practice. I do believe we need more prosperous acupuncturists, because we need more people like you working in the communities to help heal our community, because the world needs lots of healing. And it starts with healing ourselves, obviously. I want to thank the American Acupuncture Council again for this opportunity to share some of my clinical and business pearls with you.